Hi, I'm Katie Heesh, and today we are here at the University of North Texas Health Science Center in Fort Worth, and I'm here to speak with Dr. Cameron Brown. Thank you so much for being here today.
You're welcome. It's my honor and privilege to be here.
So I wanted to ask you some questions related to COVID and dealing with stress management, children, and just life generally. So the first question I have for you is, how can we help our kids understand what is going on in the world right now?
Okay, one of the first things is to be honest. And one of the references that we refer to is the American Academy of Pediatrics. And what they suggest is that we really reassure them that they are safe and that there are scientists and doctors who are researching this virus and that they are relaying the information each day. It's very important to let them know that we don't have all the answers. As
Right.
parents, we don't have all the answers. The researchers don't have all the answers now. But with them being safe at home, that reassurance, and to also, one of the things that we can do is we can model behavior for them. And we talk about the importance of hand washing. You know, take our children into the restroom and let's practice this together.
Absolutely.
And you can make a game of it, washing your hands, and let's look at the bubbles and let's make sure that we clean under our nails and that we're washing for 20 seconds. We're going to sing happy birthday a couple of times. And that to let them know that we wash our hands before we eat. We wash our hands after we sneeze, after we cough, and that to model that behavior of sneezing and coughing into our sleeves.
Exactly.
But stressing the importance of the hand washing and also engage them. And, you know, when are some other times perhaps that we need to practice hand washing?
That's great. So with the kids being at home now, because schools are closing, businesses are closing, how do we explain to them and get them to understand that it's not a vacation? What's the best way to go about that?
Well, one of the best ways is to provide structure. And many of the parents are working at home, so to set those expectations. And that when a parent is working, say if they're working for 50 minutes and then they take a 10-minute break, then establish that expectation with the child.
Okay.
Then these are, you know, this is an opportunity for you to read. This is an opportunity for you to work on math. But being clear with those expectations and providing that structure, because children feel more safe, they feel more secure when they have structure.
Okay, great. With that being said, you know, schools are closed as well as our gyms, our fitness classes, and for adults and many children, those are our stress relievers. So what's a way that we can redirect that energy since all those facilities are closed?
Well, I think being creative, and when we tap into our creativity, then that helps to mitigate our duress as well. And like you said, that physical activity is so important because it increases the endorphins in our brains, which are mood elevators. So some of the things to look at is, what can we do with our children if it is a nice day outside? Can we go out and play in the yard? Can we run around? Can we play tag? Can we play dodgeball? Some of those childhood games that perhaps we as parents enjoyed, but
Yes.
it's a quality time with the family. Also, there are things that we can do in the house. If you look at a gallon of water, then it weighs 8.2 pounds per gallon.
Perfect.
So we can use that as weight.
That's great.
If we have elastic bands, we can use those to increase our flexibility. Also, there are many wonderful apps. There are yoga apps. There are CrossFit, Zumba apps that we can tap into, and it's with the social distancing.
Right.
Again, using that creativity and staying active is going to be vital to our mental as well as our physical health.
I completely agree. And, you know, speaking of social distancing, I know that that's a huge stressor for people right now. We're so used to being surrounded by people and constantly stimulated to now being a little isolated. So how do we deal with the stress of that? And how can we keep in contact with our friends and family and not feel so alone?
Right, and we are social creatures. And I think that one of the fears that we perhaps have is that fear of isolation.
Yes.
And what can we do outside the box? You know, going back to, how about writing a letter? writing a card, sending a card, journaling, and then sharing it with others via electronics, whether it's, we're texting people. And one of the things that I'm seeing too is the use of group text for intercessory prayer.
That's great.
Yes, and if they can't come together as a congregation, then they can group text with updates and different prayers and everything. Also with Skyping and the Zoom meeting, then that's a way of actually looking eye to eye. We're going to miss out on that physical touch.
Right.
But yet through the use of our electronics, we can still communicate and reduce some of that isolation. Although I do caution, there's a bit of caution with this.
Okay.
Especially when it comes to social media, to be aware, are these legitimate resources? Some of the information that is being conveyed, we want to check it out, and we want to make sure that the information that, especially going back to sharing with our children, that is scientific, that is evidence-based, and it's not just based upon rumors.
Right.
Also, another aspect of that is a term that we call techno-stress, and that if we have too much screen time, then that can exacerbate our level of duress. So limiting that for ourselves as adults, as well as monitoring and limiting with our children.
That's great. That is so great. So in that time that we are isolated or practicing social distancing, I think it's important that we practice self-care and a lot of giving ourselves grace right now. Do you have any ideas about how we can do that?
One of the important things is to be able to practice self-compassion. I think that so many of us that we're accustomed to being caregivers, but do we really take that time to care for the caregiver?
Right.
Practicing that self-compassion. Some of the things that we can do if we can get outside is to spend at least 15 to 20 minutes outside. And in the nation, there is already an epidemic of a vitamin D deficiency.
Yes.
So if we can get out and enjoy the sun, and we call that ecotherapy, just being outside and to practice the 5 senses. Then if it means closing our eyes and practicing that mindful during a period of time, that to actually, what do we feel? Do we feel the warmth of the sunshine on our faces? Do we feel the wind blowing through our hair? Can we smell the wonderful fragrance of the beautiful flowers and the trees that are budding? But just really getting in touch with those senses, and it doesn't cost anything.
Exactly. That's amazing.
For us to do that. And to spend that time in meditation, prayer, or quiet time just being. And sometimes that can be so challenging for us to be still.
Yes.
To quieten our minds, to quieten our bodies, but to make that a practice. And to allocate 20 to 30 minutes a day, if possible, of exercise. Some of those suggestions that we had made. Practice laughing. Sometimes that we can just get, we hear this doomsday and all of this negativity and pessimism. But practice laughter. What are the things that bring us joy? It's that, if we can practice that belly laughing, and even look at our children looking at YouTube videos to laugh.
They find the laughter in everything.
Yes, yes, true. And experience gratitude. Sometimes we can have a tendency to focus on the things we don't have, the things that we're missing out on now, the things that we're losing.
Yes.
And sometimes that loss of future stories. I think so many families look forward to spring break and to vacations. But how do we, at the end of the day, if we can identify 3 things that we are thankful for, express that gratitude. And one of the activities too is cooking with our families. And that's a way of structuring time, enlisting the children and say, let's research recipes. Let's make a list of ingredients that we need. And then they can practice their math skills
That's
by
great.
measuring things, but it brings the family together. And then
Mhm.
to share those meals, because that sense of community and communion around that dinner table, and to make it a habit of the things that I am grateful for today are, and go around to each family member.
That's a great routine. I
Yes.
love that. I'll adopt that.
Okay. Okay.
Well, do you have anything else that you have to share with us today, or anything else that you wanted to talk about?
I think that supporting our brain too by eating a healthy diet,
Yes.
that's important, and expressing love and affection for others with that distance hug,
Mm-hmm.
and reaching out to those that maybe don't have the immediate family that's in their household.
Right.
And above all, give yourself permission to express self-compassion.
I think that's great. And I think, especially for you being the staff care chaplain at Cook Children's Medical Center, you are there for the staff and you're supporting them. But I think we all need to take a moment to really think about, medical professionals are supporting all of us right now. So we really need to be those people to support them as well.
Yes,
So,
absolutely.
well, thank you so much for your time today. I really appreciate the conversation and all the great information that you shared with us. If you'd like to stay up to date on everything related to COVID-19, feel free to click on the link below, so it'll take you to the University of North Texas Health Science Center website. And other than that, just stay well both physically and mentally.